Thank you so much for being here with me today. My name is Suzette Benford, and I'm the Programs Director for the Atlanta region of the Alzheimer's Association Georgia chapter. And I'll be leading you through this first module of dementia training. I've been at the association for 9 years now, and before that I worked for many years in nursing homes, assisted living facilities, and other settings with people with Alzheimer's and other dementias. And during that time, during the work days, I spent most of my waking hours right in the middle of people with dementia, working with them and interacting with them. And so I really thought at the time that I knew most of what there was to know about dementia. And then when I came to the association and I really got educated about it, I realized how much I didn't know and how much I hadn't known back in the day, and how much that knowledge would have really helped me to do my job. And I'm sure that in your job, you're also dealing with clients and families who are dealing with dementia very regularly, and you're more likely to see more and more and more of this. So our goal in these webinars is to help you feel even more capable in helping these families by giving you information, resources, and tools to help you. So before we get started with the first module, let me give you an overview of this webinar series and how it all came about. Because the number of people with dementia in this country is rising so very rapidly, there's now a nationwide push to make state agencies, AAAs and other aging services, more dementia capable. So the head of the Georgia Division of Aging Services, Dr. J. Bulott, is at the forefront of the effort to really make Georgia a part of that initiative. So step one is to make sure that we are all well educated about dementia. So DAS contracted with us to do this training statewide. And the foundation of our training came from our sister chapter, the California Southland chapter, who developed their training from an AOA, or Administration for Community Living grant. And we customized the information in that training based on Georgia's protocols and our use of the DONR. And so in early 2015, we went to all 12 AAA regions and did in-person training. And we're now offering this series of 6 webinars for AAA case managers and contractors who weren't able to attend the in-person trainings. So here we go with Module 1. Okay. So first of all, one of the main points that we want you to take away from this training is that we at the Alzheimer's Association really want to partner with you all to provide, first of all, training and support for you and your staff, education for the families that you work with, and we want to provide support services for you. And this training has been specifically designed to provide you with essential information and tools to help you assist families dealing with dementia. So, thinking about your clients, how many would you estimate have Alzheimer's disease or related dementia? And we're going to be seeing that acronym through the day today. ADRD is Alzheimer's disease and related dementias. So overall, it's estimated that for the average person working at the AAA, about 40% of your clients have dementia, and at least half of those people don't know that they have it. And over a third of people living in the community with dementia live by themselves. So that adds a whole other layer of complexity onto their situations. But we're a 24/7 resource for you and your families, and just about everything that we do for families is free. Not sliding scale, but free. So here are some of the things that we can help you and your clients and families deal with. We can help deal with challenges like difficult behaviors. Behaviors are one of the things that families struggle with the most. And not everybody with Alzheimer's is going to have difficult or challenging behaviors, but many do. We can also help with family conflicts. We're seeing more and more families where not everybody's on the same page about what's going on with the loved one. And we can help with stressed caregivers. We'll talk later in this series about how caregivers of people with Alzheimer's are some of the most stressed caregivers and how that affects their health. So we can help with that. And of course, we want to be a primary resource for education for you and your families. We send out information all the time to families. We customize packets of information, and it's all free. There's no charge for that. And we can also do education classes and in-person education, so we want to really be your go-to resource for that. We can also help with people getting lost. We'll hear more about that later. Cases where there's comorbid mental illness, we're seeing more and more of that. Alcohol abuse, and in this population, older adults, alcohol abuse is on the rise. And we can also help with cases of abuse, neglect, and exploitation. So we never know what kind of situation that we're going to be handling when we take a helpline call. And my colleague Kim Franklin is here, and she's going to give you an example of a helpline call she's handled, which you might think this is an unusual call, but unfortunately it's not. So here's Kim.
Hi, I received a call from a frantic daughter who was calling to let me know that her dad had just called her to let her know her mother was missing. The dad had driven all around the local area, the post office, the bank, the grocery store, places the mom would frequent, and had no sign of her. He also went by the church exercise class where they said she had attended that morning, but she left when she normally did and never came home. So we encouraged the daughter to have the dad call the police and get a Maddie's Call activated, which is our emergency alert in the state of Georgia, and we'll hear more about that during the wandering section, which he did, and we were able to talk to the police officer and ask him to implement a Maddie's Call. The mother was found several hours later in Alabama, where she was stopped by a state trooper driving down the wrong side of the road, and because they ran her tag and information, she did come up in the system as a missing person here out of the state of Georgia. So, like Suzette said, we never know what kind of call we're going to get on the helpline. The calls vary, and you're going to hear more about it throughout this training, the kinds of things we're dealing with, which are probably similar things that you guys are dealing with.
Okay, so thank you, Kim. That example shows that in addition to the information referral type calls that we get all kinds of calls, and we're really prepared to help families with very challenging situations like this. And Kim really dived in and got right in the middle of this, followed up with the family later, and followed them in their journey. So I think that's a great example. Okay, so these are really our learning objectives for this series. What's dementia, what's Alzheimer's disease, and what are the symptoms? Many people in our trainings, when we did the in-person trainings, said that they had assumed that they really understood the difference between dementia and Alzheimer's, but after the training, they said that they had learned some things that they didn't previously know, and they felt like they had a much better, deeper understanding of all the nuances involved in that. So we'll talk about that. And the second one is, how can we help our clients recognize and manage the symptoms of Alzheimer's disease and related dementias? And then, how can I develop the best plan of care possible to help both the person with dementia and the care partner? And one of the things we'll be talking about is that even though your client may be the care receiver, sometimes the best intervention or care plan for him or her is one that helps the caregiver. So it's a dyad that is very interdependent. And then also we'll be talking more about what the Alzheimer's Association can do to help in more detail. Okay, so here we go with the fundamentals of cognitive impairment, dementia, and Alzheimer's. For some people, this information might be a review, but for some people it may be new. And the information that we present will, hopefully expand your knowledge of Alzheimer's disease and related dementias, and that, in turn, will help you explain the disease to family caregivers. Okay, first of all, we're going to watch a video, the facts and figures from 2014, and it will show you the depth and reach of Alzheimer's disease. So that video also shows you that Alzheimer's disease affects women in this country disproportionately, both in terms of the number of women who have it and the number of women who are caregivers. And next, let's talk about the cost of care. Alzheimer's disease is the most expensive condition in the nation. And of course, it also has a devastating impact on families, but in terms of the economy, it is also devastating. Nearly 1 in every $5 spent by Medicare is spent on people with Alzheimer's disease or related dementias. The average per person Medicare spending is 3 times higher, and the average per person Medicaid spending is 19 times higher. So Alzheimer's disease is the most expensive condition in the nation, and unless we really start to address our systems of care more effectively managing dementia, these numbers are just going to rise, especially given the impact of the baby boomers. You know, we have this huge demographic bubble of baby boomers in the population. 10,000 of them turn 65 every day, and the number one risk factor for Alzheimer's is age. So we have an ever-increasing number of people with Alzheimer's in this country. And really, Alzheimer's will debilitate our healthcare system if we don't become more dementia capable as a country. So, given the enormous burden of dementia on the healthcare system, why are we, care managers and other AAA staff, and we at the Alzheimer's Association, why are we critical for effective dementia care planning and management? Well, number one, I think one of our main functions is to educate families and caregivers, and we also help ensure that care plans address all aspects of care, which ultimately impacts hospitalizations and readmissions to hospitals and the ability of a person to live at home. So we want people to be living at home longer, and that helps. We're able to ensure that care is comprehensive and effective, and we're a bridge between healthcare teams and families, and also we're in a position to make the correct referrals at the right time to make sure that the quality of life for the caregivers and for the people with dementia are improved. So we're going to talk about this a little bit later in the training, but this gets us started thinking about what our roles are in all of this. Okay, so first of all, we're going to talk about what age-related memory loss is. So I'm wondering if this looks familiar to you. It definitely does to me. I'm always going in a room and wondering why it was that I came in there, and that's normal. Okay, so first of all, let's talk about normal aging. Many people think that Alzheimer's is a normal part of aging, but it's not. It's a disease process. There are certain changes in memory and brain functioning that just naturally occur with aging. But just because somebody forgets something once in a while or makes a bad decision from time to time doesn't mean that they have a disease. So when we work with patients and families, we need to help them understand the difference between normal aging and the progression of a disease like Alzheimer's. And we need to also be mindful that different cultural groups view aging differently, and in some groups the notion of Alzheimer's being a part of normal aging may be very prevalent. So we have to remember that too. And people say often that 3 things happen before they go see a professional because they're concerned about the possibility of Alzheimer's. Number 1, they're concerned about recent memory loss to the degree that they can't remember what they ate for breakfast, or what they need to accomplish that day, or what bills they need to pay. The number 2 thing is that tip of the tongue phenomenon, where the words are right on the tip of your tongue, but the person just can't seem to get them out. And whereas with normal aging, you might remember that in a few minutes, this is where it's deeper than that, and it's much more difficult to remember. And then the third thing that happens many times before people will go to see a doctor about symptoms is when they get lost in a familiar place. They might be going somewhere and completely forget where they're going, or they may look around and nothing looks familiar to them, and they don't know which way to turn. Okay, so to help people determine whether the symptoms are normal aging or they're cause for concern, our association has developed this list of the 10 warning signs. Know the 10 signs. And because so many people never receive an actual diagnosis, we are encouraging people to really look for these 10 warning signs and to seek medical attention if they're concerned. So this list is sometimes it's a really useful tool to sit down with caregivers with to help them to recognize or realize that something beyond the scope of normal aging might be going on. So something to consider is knowing whether knowing whether somebody has potential dementia is knowing the baseline for that person. So if a person has always had a hard time remembering names, that might be more normal for them. If someone often gets lost and has a terrible sense of direction, that's normal for them. Knowing the 10 signs requires knowing if there's a change from their baseline. That's really what we're looking for here, decline. And we also have to remember that getting screened for Alzheimer's and getting an early diagnosis allows reversible dementias to be treated. And also, if the person has Alzheimer's disease or another form of dementia, early diagnosis allows families more time to plan ahead, like for legal and financial arrangements and healthcare directives and safety concerns, and also respect the wishes of the person with Alzheimer's. So let's go through the signs. The first one, and probably the hallmark of Alzheimer's, is memory loss that disrupts daily life. So that's short-term memory loss, and you can't remember very recent things. And you'll see people asking the same question because they can't remember that they've already asked the question. And then we have challenges in planning or problem solving, which is when people can ordinarily plan something or solve problems, and all of a sudden those familiar kinds of things that they always do, they're having trouble doing. And then difficulty completing familiar tasks at home, work, or leisure. For example, if someone has always made a recipe from scratch, it's a pretty complicated recipe, and they never, pretty complicated dish, and they never needed to look at the recipe, now all of a sudden they're having trouble doing that. And they can't do it at all, or it comes out wrong. That's an example of that. And then confusion with time or place. If it's more than just normal aging, we'll get confused with the time or the place. Again, you might be in a familiar place and just not recognize where you are. The fifth one is trouble understanding visual images and spatial relationships. And an example of this might be if somebody, for example, is driving a car and there's traffic coming from the other direction and they're trying to make a left turn into the oncoming traffic. They might not be able to tell how fast the other car is coming or the distance between the car and them, because their brain is having trouble processing those visual images, and they don't understand the things that they used to be able to easily in the visual realm. Okay, number 6 is new problems with words in speaking or writing. And we see, again, people who are having lots of trouble getting thoughts out or writing, like we'll hear an example from a woman in a few minutes who was having trouble writing her emails. Then number 7 is misplacing things and losing the ability to retrace steps. So we all misplace our keys and things like that, but we're thinking here about misplacing things. So if you're putting things in unusual places, like putting keys in the freezer, for example. And then number 8 is decreased or poor judgment. People with dementia often lose the ability to make good judgments, and it's one of the reasons that folks become really vulnerable to scams and exploitation. Then number 9 is withdrawal from work or social activities. This is a big red flag. If you see someone who has always loved to go to church, for example, and suddenly they don't have any interest in that anymore, or they've always done some kind of activity that they enjoy and now they're just apathetic about it. That can be a red flag. And then number 10 is changes in mood and personality. People with dementia will sometimes get irritable, or they will get maybe quiet and withdrawn. So if you're seeing those kind of signs, that can be another red flag. And I did want to let you know that the AAAs will all be receiving these documents in electronic format. So you'll have these available to you going forward if you want to make copies for your families or have them for yourself. Okay. So next, we're going to see a video of someone who has Alzheimer's. And before we look at it, I want you to have a picture in your mind of your typical idea of somebody who has Alzheimer's. And now we'll take a look at Joyce.
My sister, who lives in North Carolina, I live in New York, I sent her an email, and apparently she showed it to my brother-in-law, and she called me and said that email made no sense at all. And one of the things that I neglected to tell you was that I would do write emails, things that normally took me about 2 minutes to do. It would take me a half an hour, 45 minutes, and I'd have to read it over, and there was no guarantee it was okay, so I had another person at work read over it. And so it was hard. It was hard. And that's when I realized I thought my emails were fine. Then my sister started telling me and everybody, so I said, it's not, things aren't coming out right.
So, did Joyce fit the image of what you had in your head of somebody with Alzheimer's? Joyce is actually a PhD, and she's been very generous in telling her story and how her symptoms started. You see here with just simple things that she thought she was doing fine with, but she wasn't. And I want you to remember that you may be interacting with a lot of people just like this, who are able to communicate beautifully, verbally. Their social skills are terrific, but just because those things are intact doesn't necessarily mean that they're not suffering from some kind of dementia that we're not seeing. Okay, so let's talk about the term dementia. I think that there are a lot of people who really don't understand this term. In my experience, I've seen that a lot of people think that dementia is just a mild condition, which isn't as bad as Alzheimer's. So I've heard lots of people say, my mom doesn't have Alzheimer's, she just has a little bit of dementia. Well, we'll see, we'll talk about this. That's really not really the right way to look at it. And there are a lot of misconceptions and a lot of ignorance about the disease process. And to effectively care for our families, we have to teach them about the disease so that they have the correct information. Okay, so first of all, people might not be educated because there's still a lot of stigma around Alzheimer's disease and other dementias. And a lot of the labels that we use to describe people with dementia, and just the elderly in general, are negative and demeaning. So you probably heard a lot of these negative labels that are on this slide. We tend to think of one image of dementia and forget that there are really many faces of this disease. So you'll hear people say that the person is a wanderer as opposed to a person who wanders, that they're crazy, they're a burden, they're incompetent or difficult, or an empty shell, or that they've lost their sense of self, or that they're dead already, or that they're unaware. And labeling people does not help in reducing stigma. It just fuels our fears, and that can be harmful. So we want to encourage people to talk openly about this disease. I think that's very important, and to get screened if they're concerned that they have it, and to plan for the future. So here we see many familiar faces. One of these slides is Pat Summitt, the famous Tennessee basketball coach, and we have Glenn Campbell. There's also a person who's a volunteer for the Alzheimer's Association who has dementia, and then a man named Henry, and of course Ronald Reagan in this slide. And people with dementia retain their identity for a long time, their sense of self, despite their cognitive and functional losses. They have abilities, strengths, values, preferences, strong opinions. Every single person with dementia is unique, as we'll talk about as we go along, and they need to continue to be recognized and valued. First of all, let's define the mildest form of cognitive impairment, which is MCI. MCI causes cognitive changes that are serious enough to be noticed by other people, and they will show up on tests, but they're not serious enough to interfere with daily life or independent functioning. And people with MCI are at greater risk for going on and developing Alzheimer's disease, but it doesn't necessarily mean that they will. Some people never get worse, and a few people actually get better with a diagnosis of MCI. Okay, so many of you are probably familiar with the American Psychiatric Association's Diagnostic and Statistical Manual. The DSM-5 is the latest version of that, and they've replaced the term dementia with major cognitive disorder or major neurocognitive disorder. So in this new definition, the person has to have a change from baseline in one or more of these domains: complex attention, executive function, learning and memory, language, perceptual motor, and social cognition. And the deficits are severe enough to interfere with independence and daily activities. So we've not seen this term, major cognitive disorder, replacing the term dementia. We're not seeing it come into common usage. So we're going to continue to refer to it as dementia, but we did want to let you know about the change in the DSM-5, in the new version. So, having said all that, if you go to the doctor and you get a diagnosis of dementia, well, you already knew that. You already knew that you had a decline in cognitive functioning severe enough to interfere with your daily life. So the question really is, what's causing the cognitive decline? Okay, so first let's talk about the potentially reversible causes of dementia. And again, this is a reason for people to seek a doctor's opinion early, because sometimes there are symptoms or there are causes of dementia that the doctor can treat and potentially reverse. And they've used this acronym of dementia to list the different causes. The first one is depression, which, you know, depression often goes hand in hand with dementia, and it's another reason to really seek a specialist, because a skilled specialist can tease out, is this person having symptoms because they're depressed, or is it because they have some kind of dementia and depression might be going along with that? Depression that's serious enough can absolutely cause changes in memory. And then delirium. If a person has medical conditions and has delirium, that can definitely cause them to be confused and disoriented. The E represents emotional disorders like depression and other emotional problems. The M is for metabolic disorders. One of the things that doctors screen for is problems with thyroid. The E is eye and ear impairment. If you have significant enough, for example, hearing impairment, you might not be hearing what's said, and that's why you can't remember, as opposed to just having problems with memory itself. And then the nutritional N, that's things like B12 deficiencies or electrolyte imbalances. Those things can also people to get very confused and have difficulty with memory and cognition. And then tumors, things like brain tumors or brain injury. We see with the NFL players that their head trauma, their brain injuries are causing them to have significant symptoms of dementia. And then infections. Infections like urinary tract infections are famous for causing people to get confused and disoriented. So particularly when somebody's had a dramatic or rapid change in their baseline, it's one of the first things that physicians look for. And the last one is alcohol, drugs, and medical interactions. So, many older adults are on lots and lots of medicines. Very often they go to several doctors, and the different doctors don't know what's being prescribed by the other doctors, and you have people ending up on lots of medicines, and they can interact with each other and really be causing some significant problems. There are also over-the-counter medicines which people might not realize can really affect older adults. An example of that is Benadryl. Benadryl or sleep aids in general can really affect people drastically and cause them to have issues with their memory and with their cognition. Okay, so this slide shows that dementia is really the umbrella term, and various diseases or causes of dementia fall under the umbrella. So again, the question is, what's causing the symptoms? And dementia, this is an analogy, dementia is really like saying flowers. And there are a lot of different types of flowers, like roses and tulips and jasmine. And that's similar with dementia. There are many types of dementia. Alzheimer's disease accounts, though, for about 60 to 80% of all dementias. You'll see estimates ranging from 60 to 80%. And this is why we focus so much on Alzheimer's disease. So again, if mom has just a little bit of dementia, somebody's telling you that, statistically, she probably has Alzheimer's, and it's just in the early stages. This slide represents just a few of the different forms or causes of dementia, and we're going to talk more about each one of the ones here in more detail. Vascular dementia is believed to be the second most common kind of dementia after Alzheimer's, and generally the damages in the brain is related to reduced blood flow from one or more strokes. The onset can be sudden, and it may or may not progress. Progression may be stepwise, which means that it sometimes occurs in sudden changes, and then somebody will level out and then have another change and level out, rather than a slow downhill slope like Alzheimer's. The symptoms depend on the area of the brain that's impacted. So memory may or may not be affected, especially in the early part, and people can have difficulty focusing their attention. They may have confusion, but they also may have memory impairment. And people with vascular dementia often really benefit from physical or occupational therapy, but the severity of the stroke and the number of the strokes that they have impact the likelihood that the symptoms will improve or not. So now let's talk about frontotemporal dementia, or FTD. There are many types of frontotemporal dementias, but in general, these dementias begin at a much younger age. Usually people are in their 40s and 50s when the symptoms start. And it's the only dementia that affects statistically more men than women. And also the progression is generally more rapid than with Alzheimer's disease. The first symptoms that are noticed are not so much memory, it's personality and behavior changes, and people can get disoriented. And their speech and language abilities are sometimes affected. But really these personality and behavior changes are the hallmark. People can get disinhibited and do things that are very out of character for them, like, for example, spending lots of money, or they might say inappropriate things with no awareness that they're being inappropriate. And also, because people are usually younger when the symptoms arise, the medical community might assume that, oh, this is just a midlife crisis, or maybe even some kind of mental illness. So it often takes these folks a long time to get diagnosed. And it's especially tough on families, because you're seeing all these very unusual behaviors, and it can really, really cause problems in marriages, and it's very difficult for families to deal with. Next, let's go on to dementia with Lewy bodies, or Lewy body dementia. With Lewy body dementia, you have very widely fluctuating attention and alertness, changes in cognitive ability, but really some of the hallmarks are hallucinations and Parkinsonian-like symptoms. Like, it might not necessarily be so much tremoring, it might be just muscle rigidity or problems with gait. So sometimes these folks will fall down. They also tend to have problems with their sleep. And I've seen lots of folks who say that their loved ones will wake up from sleep, and they will have been having very vivid dreams, and they will sort of continue that dream on into their waking, and they will sometimes have a very paranoid flavor, and they will strike out against their loved ones, which obviously is very disturbing. And also, this is an excellent reason for somebody to go to a specialist to get a specific diagnosis, is that with Lewy body dementia, they have huge potential for adverse reactions to antipsychotic medications, which are often given when behaviors are involved, when people have dementia. But when you give them to people with Lewy body dementia, it can make them worse. Okay, so let's go on to mixed dementia. This just refers to Alzheimer's disease and another kind of dementia happening at the same time. And it might account for about half of the cases where Alzheimer's is present. And usually the most common combination of mixed dementia is Alzheimer's and vascular dementia, but it can be others as well. And now we move on to Alzheimer's disease. And as we talk about this, again, some of this information might be a review, but what's really important here is our ability to relay this information to family members and caregivers. As we talked about before, for effective dementia care management to happen, families really have to be involved in the process of understanding the basics of the disease process. So as we move through our training, we need to be thinking about effective ways to share this information with family members. So Alzheimer's disease is affecting about 5.2 million Americans as we speak. It's the most common form of dementia. Again, 60 to 80% of dementias are Alzheimer's. It's a neurocognitive disorder, and a clinical assessment is really required to diagnose it. Although millions of people in the United States have it, we know that many, many people go undiagnosed. The onset is usually gradual, but the decline is inevitable. It is a progressive and degenerative disease. And again, the major symptoms are impaired memory, thinking, and sometimes behavior severe enough to interfere with daily life. And there's no cure right now for Alzheimer's disease. It's 100% fatal. So when you go to the doctor and you get a diagnosis of Alzheimer's, you've just gotten a terminal diagnosis. And just to say a little bit about the biology of Alzheimer's, plaques and tangles are the hallmark neuropathological brain changes of Alzheimer's. The plaques are a buildup of amyloid protein in the brain, and as the disease progresses, neurofibrillary tangles develop, which are made up of tau. So the plaques and tangles can actually appear in the brain years before we see any memory impairment. And much of the research now is devoted to trying to detect these changes and do something about them before the actual symptoms begin. So on this slide we have a picture of, on the left, of a normal brain, and on the right a brain of a person with Alzheimer's disease. So notice the size. Alzheimer's actually shrinks the brain and shrinks by about 1/3 of its original size in people with advanced Alzheimer's. And so here we have a cross-section of a normal brain. So you see that it's mostly brain tissue. It's very filled out. And in the next slide, we see a cross-section of the brain of someone with Alzheimer's disease. So you see that the spaces between the brain tissue is expanding as the brain tissue actually dies and shrinks. So we encourage you really to remember this photo, this image, as you go through this training. Because if we can convey this to families, that the brain is actually shrinking, it will help them understand that it's a disease, and the things that go along with it and the behaviors associated with it are not intentional. It's a result of all this damage going on in the brain and of the loss of brain tissue that the people are suffering. So next we're going to see another little video. We're going to take a look inside the brain and see what happens when someone has Alzheimer's.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
So I really like this video. I think it gives us an inside view of what's happening in the brain. But I do want you to be mindful that the video simplifies the progression of the disease, and it makes it seem more orderly than it might actually be. And this is also very important to remember because the disease really does affect the brain somewhat differently for each person and at different times. So, if we imagine that we have a toothbrush in front of us, for one person whose damage is a little bit worse in one area of the brain, they might be able to say the word toothbrush, but they might not be able to know what to do with that toothbrush. Another person might not be able to say the word toothbrush at all, might not be able to remember what to call it, but they know what to do with it. Another person might have the concept of a brush, but they might try to brush their hair with it. And it all depends on, for that individual person, where the damage is in their brain and what it's doing to their brain. So when you hear us say sometimes, if you've met one person with Alzheimer's, you've met one person with Alzheimer's. This is really what we're referring to, is that everybody goes through it differently, at a different progression and with different symptoms, even though obviously we do see some commonalities amongst people. So, what does this mean for your work? Is it important to be aware of how dementia affects your clients and their families? Of course it is. Understanding that the person has dementia and what that entails helps us with the expectations of what the person can and can't do. We don't want to be setting unrealistic goals for them. We want to be able to recognize the potential safety issues that are present for the person in the stage that they're in. And we also, if we understand the dementia better, we understand what the challenges are for each caregiver and what's a problem for them at that particular time. So I want to thank you very much for being with me through this first module of this webinar series. Please remember to keep our 800 number handy. The 800 number is 800-272-3900, and remember that you and your clients can call us 24/7. Thank you very much.